Hello, Dr. Ruiz here, Options Rehab. And I just wanted to do a little video today to go over some of the things, or at least answer some of the questions that a lot of patients have about the coronavirus issue that's going on today. The virus is something that is going to pass over time. We have to be very cautious with how we handle ourselves during this time right now because it is highly contagious. But there are some things that are put into place, and the CDC has been discussing a lot just to keep everybody as safe as possible. So the first thing, obviously, is social distancing. Everybody has heard that. It's all over the news. Keeping your distance, even if you're at a supermarket, which is where I see most of this really becoming almost unavoidable. It's important just to keep that 6-foot distance. And remember, the distance is just in the case that somebody coughs or sneezes and doesn't have a mask, or has a mask that's very weak and it gets through the mask, gets on you, and then gets either in your eyes or in your mouth. These are all the ways that it can be transmitted, which is still very difficult to think about, but it does happen because it travels through, the molecules travel through the air very easily. So it's unfortunate, but just be careful out there. Protective wear, something I want to talk about, when I go food shopping with my wife. We wear gloves, wear a mask, and I also wear glasses. I actually wear sunglasses, even if it's not sunny out. And the sunglasses are really to avoid the fact that I may put my fingers in my eyes. And the mask is also to avoid that I put my hands anywhere near my mouth. And then you have gloves on so that in case you touch anything, you can just get rid of the gloves. So those are just a bunch of safety factors that you can do. One of the things about food shopping that I wanted to talk about that's a big concern is people are very concerned about this being on food. And there hasn't been any studies that have actually shown that the virus can live on food, so contaminated food, that can affect you. For the virus to affect you, it's a respiratory virus, very much like the SARS virus. And for it to affect you, you actually have to breathe it in. So eating it on food is not going to cause any danger because it gets into your stomach, and it becomes, your stomach digests everything and kills everything. The gastric acid's in there. Not much can live in there. So even if somebody sneezed on your food and you ate that, the chances are very unlikely that you will be infected with the COVID-19 from what the studies are showing right now. Containers, you can transfer your containers. So when you order food or buy food, you want to transfer them to clean containers, that's fine. All you got to worry about is washing your hands afterwards. If you get produce, you want to wash them with water. Don't use soap. You don't want to use anything crazy on it. Just water is sufficient. Give it a good scrub. Clean your hands first and then give it a good scrub. I think that's pretty much it on that. That's a big topic a lot of people ask about. As far as keeping healthy, you want to make sure you get plenty of sleep. If you can't sleep at night, I've discussed this before, a little bit of melatonin helps out tremendously. The other thing you could do as far as making sure that you're sleeping is exercising. You want to get in 20, 30, 40 minutes of exercise a day. You don't have to kill yourself, but you want to do enough to break a little bit of a sweat and boost your immune system. Studies have shown that exercise absolutely boosts the immune system, so that's important. Not to mention, it will get rid of some of the stress, some of the toxins that build up in your body, and you can have a restful night of sleep. The one thing you want to be careful with exercise is maybe don't exercise too close to the sleeping time. So working out around 8 o'clock at night, it's likely that you'll have a difficult time falling asleep by 10. You almost get a little bit of surge of energy when you exercise. I think that's it on the exercise. Let me see what else we have. The one thing I wanted to talk about too is something we're doing in our office. So right now we closed our office, and we're trying to join the fight against this COVID-19 by social distancing and just eliminating the possibility of transmitting or being a catalyst for this virus. So it's unfortunate, but we're under mandatory quarantine. One of the things I wanted to let everybody know is that we are doing telehealth sessions. So we are doing physical therapy in your own home with virtually just a video like we're doing now. And we send you some sample of exercises. You can do it on a cell phone. We guide you through the way. We can demonstrate the exercises. And it actually is a lot of fun. There's a lot of interaction between clinician and patient. And it's a great time because there's no excuse that you've got a ton of things going on, so you can actually tune in and have a session and really get some benefit from that. So we are doing that. For anybody who wants to do that or has any pain or issues that we were treating already in the office and we're going to continue, that would be something you could do. You can just send us a message, send us an email to info@optionsrehab.com. You can text us at our office number, 973-661-4601, and or you can just call us, obviously, at that same phone number. So a couple different ways. We'll get back to you, and we'll actually be scheduling out our schedule. We're going to be doing it likely throughout the day. Maybe we'll do some afternoon shifts because we see that there are some people that are working from home, so we have to catch them when they're off from work. I'd encourage anybody to ask me any questions so that we can build some rapport on video and have a good back and forth discussion about things, because I know there's a lot of questions that people are asking about coronavirus and there's a lot of uncertainty, but I can guarantee you that this will pass. It'll take a little bit of time. Remember, we have blunted the curve. We've reduced the impact of that peak of the curve, but that also means that it stretches out longer. So we're flattening it, but it's getting wider, which means we won't see a surge, which is great for the hospitals, but unfortunately is probably going to linger a little further than we all like to hear about. So it just is what it is, and it's unfortunate, and we have to just keep going. So I think that's all I have for today. I just want to say relax and just do everything you can to stay home and take care of yourself and stay healthy. Options Rehab, Dr. Ruiz. Give me a like, give me a share, all those good things. Thank you. Have a great one.